On this short, I'm going to start with the symptoms, and then I'm going to have you guys guess what it is. And I think that's the best way to do this problem. So we got a patient over 50. She's got some jaw pain while chewing, fatigue, transient vision loss. What's your top concern? Giant cell arteritis. That's right, a large vessel vasculitis that can lead to irreversible blindness. But what do you do first? Do you jump straight to the biopsy? No. First, you get the ESR and the CRP. They're fast, sensitive, and they tell you if you're on the right path. Those are inflammatory markers, and if they're up, and they usually are, then it's time to do a temporal artery biopsy. But don't wait for that result to treat. Start the steroids if the GCA is strongly suspected, and then let the labs confirm it afterwards. Okay, so we got a 70-year-old woman, transient vision loss, jaw pain while chewing, fatigue, aching shoulders, physical exams normal. What's the most appropriate next step? It's going to be your ESR and your C reactive protein tests. Let's talk about why the other ones are wrong. Temporal artery biopsy. So that's confirmatory, but do your ESR and CRP first to determine if the biopsy is warranted, right? Least invasive first. CT head, used for stroke, but this is a GCA, so it's not going to be a focal neurological deficit. So yeah, let's not do that one. Carotid ultrasound, that's for your stroke as well, not helpful in your vasculitis workup. And echocardiography, that's using a embolic source, not going to be relevant here to your jaw claudication. So it really just cues you into how this is giant cell. Okay, so here are the symptoms. Age 50, female predominance. Got some like headache problems, jaw claudication, scalp tenderness, amaurosis fugax as well, your transient blindness. Very important to kind of note that. Polymyalgia rheumatica, proximal joint pain, stiffness, and your CRP and your ESR is going to be very high. So you have a risk of permanent blindness if you miss this. So yeah, you confirm it with your temporal artery biopsy after you do the labs. Now, what we like to do here on this channel is we like to methodically break things down and use the highest yield first aid points so that you know what's most important about giant cell. So what's most important about giant cell is headache, jaw claudication, visual disturbances, polymyalgia rheumatica. So the steps of this question are identify the symptoms, jaw claudication, transient vision loss. Boom, step 1. Step 2, ESR rate, sensitive for inflammation. All right, this can be elevated. Why? Because, yeah, you got some inflammation going on there. Step 3, the distinction between GCA and other conditions based on the symptoms in the tests, right? While other tests like angiography, head CT might be relevant for other conditions like a TIA or like a stroke, they're not best for GCA. All right, so those are the 3 steps that you need to solve any question associated with your giant cell. If you guys think this is helpful, then please like and subscribe. We'd love to take this channel to the moon. Oh, and then also the plan here is to develop our own testing platform and give you guys all of these AI tools. So just by subscribing, you are feeding into that vision, that dream. I want to democratize medical education. I want to give all this content for free or extremely low cost to any student who needs it. That's my goal here in doing this. Spreading awareness, spreading education about medical topics, and also providing free resources for medical students so you guys don't have to pay a ton of money. We're already paying so much to go to medical school. Why do we have to pay more for awesome high-tier resources, especially when AI is really changing the game? So anyways, like and subscribe if you support that vision, and yeah, we'll see you guys in the next video. Ciao.